And thank you, Erik Fosse, for your inspiring and wise words. Back here in the studio with a duo on the sofa. We have Teija Koskinen, CEO Medikumppani Finland, based in Turku actually.
Yes.
Welcome. And Suhail Mirza, author and global workforce wellness coach, Lang Bison, United Kingdom. Did I pronounce Lang Bison right correctly?
Yeah, Lang Bison.
Lang
Yes.
Bison,
Yeah, okay. Hey, great to have you here. And Suhail, a small curiosity, it's your first time in Finland. You landed here last night.
Yes, indeed, I did.
So first impression, not very tropical, not very sort of, warm and...
No, it's wonderful. It looks very well ordered. There's some wonderful architecture. And I, from a child, was a fan of Lasse Viren.
I see.
And also, in English, of course, read Senuhi the Egyptian from Mika Walteri. So to come to Finland is a wonderful gift.
You chose the right words there. Thank you very much.
So you have even one day to enjoy this country, and then you're flying back tomorrow already.
I hope it will be the first of many visits.
Wonderful to hear that. Yeah,
very welcome. I mean, hey, great to have you here in the studio, and we have a sort of short introduction before the interview proper, so to speak. Teija and Suhail, we're going to talk about healthcare workforce that has never been more center stage for policymakers globally like it is today due to the global pandemic. That's one theme.
Yeah, despite the promise of a post-pandemic world, the promise of the vaccine efficiency globally, the healthcare sector is facing unprecedented pressure in terms of people, process and patients. So we're going to touch those arguments as
including the Nordic region, the rest of mainland Europe and of course the UK.
Sure.
Yeah.
And therefore it is vital to discuss with the people who are helping to resolve the challenge facing the healthcare workforce. So something needs to be changed and fast. Mm-hmm. Those are mainly the key arguments. And this is a global issue facing the whole world. Mm-hmm. And Teija, can you share the insight about the situation in Finland in terms of healthcare workforce shortage?
Yeah, thank you, Ella. Well, we have over 20,000 doctors and 74,000 nurses working here in Finland.
And there's a shortage.
Yeah, there's a shortage, but we do have that much. The number might sound relatively high, but it's not when compared to the number of open vacancies we have here. So it's candidates market, but at the same time, our candidates aren't doing that well. Each month we have over 2,000 open vacancies, which to my ear sounds that we also have 2,000 work communities working without proper resources, which might be okay for a while, but this situation has been the same for years already. And I know that there are several reasons behind the current stage, but now it's not the time to look for any explanations or to look back, but to bring to the table new initiatives, lots of them, just anything disruptive to the current state.
Because there's a bit of a challenge anyway, that demographics don't look good.
Exactly. The aging population, also the graduates, the relative number of graduates as well. So there are many reasons behind the current state.
You face the same problems in the UK as well?
Absolutely. I mean, the NHS is a huge employer, 1.3 million people. But going into the pandemic, we had over 50,000 vacancies for nurses, 115,000 full-time equivalent vacancies right now.
So the question is, can they and will they be filled, or does technology have to somehow take over all?
I think it's a combination of increased productivity and finding ingenious ways, which we're going to touch upon, to help that. And the projections are continued. The Health Foundation projects that that number will double every 5 years. So in a decade, the NHS will be looking at 458,000 more people that are required. So it's a substantial challenge, and you have to put it into the context of record numbers of people waiting for elective surgery in the NHS, 5.6 million.
So in the short term and in the longer term, so what are the solutions? What do we have to do?
Well,
we can both answer this question.
Yeah, well, we can always help the situation with recruitment, of course, which might sound tricky because of the shortage.
And where do we take the people from? Because the thing is, the shortage is because we just can't get in the people that are required.
But the question is how to do it. So my suggestion would be
Kidnap Shanghai?
That would be a great idea. But though I'd say that it's combining our forces because we need it all. We need temporary workers. We need direct placements. We also need nurse and doctor practitioners too. What I would like to see even more is the collaboration between the agencies providing the resources. And something we should not forget either is also the power of employer branding. What makes our hospitals...
And that's one of the points. I mean, the healthcare sector, at large, both in the UK and in Finland or wherever, like globally, is it sort of sexy enough? Has it got the pull, or should it be sort of rebranded or somehow trimmed?
I think today, given the unbelievable sacrifice and heroism of the healthcare workforce over the pandemic, I think now is no better time to really increase the brand awareness, and working in healthcare is a privilege and an opportunity.
Great point. There are many stories to be told, sort of brand stories.
And taking up Teija's point, I think recruitment has to be done more creatively. In the UK now, managed services help hospitals to manage their supply chain in permanent, temporary and agency workforce. And also, that's like, if you think of it as a bucket, we have to fill the bucket with additional workers. But we must stop the bucket from leaking. So retention is vitally important. Keeping the people that we have already. 56,000 people left the NHS between 2011 and 2018.
Oh, the numbers are quite cruel then. But what kind of examples could you give us about the recruitment, for example?
But if it's not too provocative, but we're seeing this over, the 20th century, people from, poorer regions coming to the industrialized world, which has saved the industrialized world because that's how you fill a lot of these positions. Is that the story for the future as well, or do we have to do something different? Or should we do something different?
International recruitment in the UK, has been a key policy lever, and it will continue to be so. That's in the long-term plan.
So that's one of the solutions.
That's one of the solutions. But going to the retention point, the numbers are, we have to change the culture. So, for example, the NHS staff survey recently showed that almost 1 in 5 workers in the NHS have reported being bullied or harassed by their colleagues. This is a huge issue.
Which doesn't sound good now.
40% of people have reported being sick because of chronic work stress. So what has happened in the UK, there has been a policy initiative, an introduction of the People Plan, which is going to highlight flexible working, equality and diversity, and wellness and well-being. All of these things. I've been privileged when I wrote the Lang-Buisson workforce report to interview over 100 chief executives across the NHS and the healthcare sector, and they are definitely committed to making this a true change culture-wise. That will be
sorry, Ella, just one thing. And there seems to be, of course, in our sort of work culture today and looking towards the future, at least very much talk about the fact that we shouldn't accept bad behavior and bullies and stuff in the workplace. So at least it looks as if at least the talk is such that we are seem to be heading in the right direction.
I think that's been recognised. Yes, absolutely.
I wanted to ask Teija about how the situation is in Finland.
Well, the situation is similar in Finland, and we are seeing the signs already about that healthcare workers would like to be treated more, that we show that we actually care about their wellness and about them. And I've seen that for the past 20 years of being a leader, that is the best way to actually keep those good employees, that you show that you care and you're securing their wellness as well. So that's...
Do you have any of the lowish salary things, fatigue, burnout?
Yeah,
so
all
it
of
must
that.
be huge problems in both countries.
Well,
or challenges at least.
Well, a few years back in 2019, where Medikumppani conducted a survey about the job exhaustion of doctors. Over 800 physicians responded to the survey. And over half, 60% to be exact, admitted that they felt some sort or some level of fatigue or exhaustion. So what causes the stress is the limited time with patients, workload, but of course also work-related tasks.
A huge responsibility, of course. I mean, we're human beings, and seeing people in that state is, of course, can't be easy for anyone.
Yeah, and at the same time, there is also these factors that are found to be empowering, such as collegial support and work community, but also rejuvenating leisure time, of course. Something worth to mention here is also that the management level needs more support too. Our chief doctors and nurses are very alone with their everyday challenges. So I would like to see even more resources and added support on management level too.
And workforce wellness, Suhail, that's where we come in with you especially. So how do you tackle fatigue, stress, burnout?
These symptoms?
Well, I think just to reiterate the situation in the UK, the word, this is not my word, this is the Health and Social Care Select Committee from the Houses of Parliament. It's an emergency situation now.
So it's that severe?
That's their word. The threat of burnout, the need to support the workforce. The report came out literally a few weeks ago over the summer of 2021. That's the situation that we're now facing. So we're seeing 1 in 5 doctors in training, according to the General Medical Council, feeling as if they're being burnt out. The BMA, the British Medical Association, have said that 50% of doctors post-pandemic are thinking about reducing hours. Now think about the huge demand that we've got, the waiting list. This is a perfect storm. It's a perfect storm. No, absolutely. So that is the huge challenge.
So what to do?
So we have to find, as Teija said, we have to find ways to support each of those individuals that work in the system with resource, evidence-based action. The work that I've done over the course of the pandemic, in particular, in my wellness coaching, draws on traditional models, epistemologies that are throughout the world, very inclusive approach, mind, body and spirit, to be able to support people with simple actions that they can take every day and immediately to empower their emotions.
What has been the response?
The response globally has been fantastic. I've done these webinars around the world, Asia, Europe, North America, and people, I think we're seeing a revolution. People are now open to the idea of oneness and connectivity, which is behind that type of outlook in life. And they believe that there is not just one path and every person must be treated as an individual.
I think it's good in a way, also sort of thanks to technology and stuff. So we are much more in a global village than ever, and people by default have to feel more interconnected than ever before because we are. I mean, the gadget I have in my pocket and stuff. So we are this close to each other all the time. So it's now or never in a way.
I agree, and I think where we are is it's similar to where the environmentalist movement was 20, 30 years ago, which was a marginal movement. Today, now it's centre of all policy. Yeah. So the idea of mind, body, spirit approach to wellness is now at that stage of revolution. But technology is very, very powerful, and I was very privileged to work with Teija and her team in delivering a webinar here to the team in Finland.
Well, tell us a bit about the collaboration.
Well, that was most certainly one of the greatest things, because I think that we need to share the best practices, and we can bring that knowledge and expertise also from cross borders. And about the technology, we've done various things at Medikumppani. We started hosting these so-called how to encounter the patient webinars for our nurses and doctors, just to provide new tools such as communication skills and emotion skills, also for leadership. And our coach Pauliina Aureksinen-Aminov has done a remarkable work on this field for over a decade. But we also started using a system called Winning Temp, which is a platform allowing our employees to communicate and share their thoughts and feelings, and they can do it anonymously. So what happened after we started using the system was actually that we became aware of our own blind spots. So we were able to improve our own leadership, for instance, and also, of course, enhance the job satisfaction of our own.
Sorry.
So
I think anyway, I mean, the culture now, or the trend, or what's the talk of the town. I mean, we're doing sort of work-life mindfulness and stuff. So it's, as you said, like the environmental movement, how it was in the beginning. So these things are gathering momentum, I guess, and it's more and more on the agenda all the time.
Yes,
which is good.
Yes, indeed.
Yeah. Well, I just recently had a very brief experience at the hospital, one of the biggest hospitals here in Helsinki, and excellent treatment, wonderful experience. Hopefully don't have to go there back ever again. But what I sensed and felt from the nurses and the doctors is that they wanted feedback from the patients. And I think that's also very important, that
A human need, basically.
the human
need in a way.
we need to help the ones who help us by giving feedback.
Exactly.
Suhail and Teija, thank you very much. And I have to ask, did you, Suhail, come here? No, or in Finland, is this now your early program? Are you doing something else? Are you, sort of work related?
What is that
are you using
on the sofa?
So that's the Lang Buisson UK Healthcare Workforce Report, which draws on a lot of the work from the interviews that we've done, and I was very privileged to be able to write that.
Okay, great.
Good.
Hope you have a sort of fruitful time here and get things done and fly back home with a baggage, bag full of new.
No, I'm very grateful
ideas.
for the warm welcome, and I know that will be working very closely with Teija and supporting her passion and vision, which is very inspirational in terms of engagement.
Wonderful to hear that.
Thank you very
Thank
much
you.
for your visit.
Thank you both.
Thanks.
Thank
and
you.
good luck in the future.
Pleasure.
Thank
Pleasure.
you. Pleasure.